How's it guys, and welcome back to my channel. Today we're going to continue with ECGs. If you haven't watched my previous channel, I'd recommend you go check it out, because if you're not quite sure with what's going on this page as it is, you know, PQRST and all that sort of thing, it'd probably be best that you jump back there quickly. But if you have watched that, let's get going. Alright, so in this lesson we are going to be talking about heart blocks or bundle branch blocks. The same applies. We look at rhythm, we look at rate, we try find what is normal and we try find what is abnormal. So we're going to try and work out rate. So we have how many big blocks between each QRS? 1, 2, 3, 4, almost, let's say 5. So we're going to take 300 and we're going to divide it by 5. So that gives us that. Then we're going to look at, is it regular? So you got your R waves. Cool. Regular. Do we have a P before every QRS? Do we have a QRS after every P? So P, QRS, QRS, P, P, QRS, QRS, P. All right. Fantastic. Now let's look at the PQ interval, which is, remember, not more than 0.22. So that's no more than 4 or 5 tiny little blocks. So that's, and remember the the P wave starts here, not on the top. So that's 1, 2, 3, 4, 5, 6, 7, 8. That's almost 9 little blocks. So that's obviously very prolonged. And you can see that the same thing happens in every QRS and P. So what we have here is a bradycardia, because you can see it's slow, and you can see that the QRS is normal. It's no longer than 0.12. So 3 little blocks. That's 1, 2. It's only 2 little blocks. Fantastic. The P wave also looks normal. So what we have here is a first degree block. All that means is that the PQ interval, the PQ interval is prolonged. That is the first degree heart block. All right, so let's look at this ECG. So straight off from seeing it, we can see that there's a big block here of something, or there's not something that's supposed to be happening. So let's look at rate. So is 1, 2, 3, 4. So that's 4 big blocks. That's 300 divided by 4. Which is 75. All right, so now we want to look at our P waves. Our PQ interval is 1, 2, 3, 4. It's normal. QRS is 1, 2, 3. All right, normal. T waves look normal. Do we have a P wave before every QRS? So PQRS, PQRS, and then nothing, and then another PQRS. All right. So now, what is our PQ interval? All right, so that is 1, 2, 3, 4, almost 5. 1, 2, 3, 4, 5, 6, 7. So that's not regular. And here we can see 1, 2, 3, 4. So it's 4, and then it went to 5, and then it went to 7, and then it had nothing, not even a P wave. Then we can see here that there's another PQRS, so it's P is 1, 2, 3, 4. So now it went from normal to broader to normal. So this is a heart block. So what we have here is a second degree type 1. So what's happening is that the PQ interval is normal, and then it gets prolonged, and then it gets prolonged, and then it drops completely, and then it starts again. So that is a classical second degree heart block type 1. You can see that the QRS is normal. You can tell that the R waves won't be regular because the P wave is increasing in length. And you'll see that if you were to take a piece of paper and counted how far your R waves, or rather, sorry, your P waves are, you see there's a P wave, and then it's not the same length, and then there's no P wave. And so you can see that your P waves are not consistent, so your rate is not consistent. But that we can see is that there is no P wave and then no QRS. It's the P wave and the PQ interval increases and then drops and then starts again. That is a classical second degree type 1 heart block. All right, so let's have a look here. What is the rate? We can't tell rate because it's irregular. You're going to have to look at your ECG, or you're going to have to print a 10-second strip. So now we're going to look at, does it look normal? Do we see anything that's missing? I can see just straight off that there's something missing here because this is broader or bigger than that. All right. Do we have a P wave before every QRS? Do we have a QRS after every P? That's P, QRS, T, P, and then there's nothing here. P, QRS, T, P, QRS, T. Cool. So all I see is a gap here. So what's going on here? All right. The P wave is only 3 little blocks long, so that's absolutely normal. The QRS is 1, 2, 3 little blocks. That's also perfectly normal. The T wave looks normal. So the QRS is not broad. P wave is there, so the atria is firing. But what we're seeing here is, do we have a P wave before every QRS and a QRS after every P? It's a P, QRS, P, and then nothing. So what's happening here is that we have a second degree type 2 heart block. The way you define this is that your PQ interval is the same, your QRS is normal, and then what you want to see is that there's a beat and then you drop a beat, and then there's a beat and the beat, and then you're probably going to have a drop a beat here. So the way you tell that this is a type 2 and not a type 1 is that the PQ interval is consistent. Consistent, then it drops, and then it's consistent, and it's consistent. So that is a second degree type 2. All right, let's look at this ECG. So remember, can we tell rate? Well, that looks very long. So that's 1, 2, 3, 4, 5, 6, 7, 7.5. So 300 divided by 7, 7.5. We're sitting, yeah, that's right. So then what we want to see is that, because only we only have 2 R waves on this ECG, we can't tell whether it's regular. But what we can do is that we can see that, do we have P waves after every QRS? Do we have a QRS after every P? So there's a P wave and nothing, a P wave and a QRS, a P wave and nothing, a P wave and nothing, P wave and a QRS. So what is interesting here is that we have, some have P waves and QRSs, but there doesn't seem to be a pattern or anything that's really normal. So what you want to do here is that you want to take a piece of paper and you want to put a dot or line and look at whether your P waves are consistent. So P waves are there, 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 and there. So you'll see that your P waves are firing consistently, which means that it's not a type 2 second degree, and it's definitely not a type 1, because you can see how that is landing in there. However, you can also see that your QRS and your QRS are also regular, but not synced to your P waves. So what you have here is a disassociation between your P waves and your QRS. So this is a complete heart block, or a third degree heart block. So that is how you would tell that you have a third degree heart block. You can also see that your P waves are the correct length, and you can see that the QRS is not more than 3 little blocks. So you don't have a broad QRS, and you can also see that your P waves are looking normal. The important factor to remember is that your P waves are consistent, your QRSs are consistent, and that what you are able to tell is that there's a complete disassociation between the two. And so you can see that your P waves are consistent and your QRS are consistent, and that's how you're going to tell that it's a third degree or complete heart block.